That's really extremely interesting to me because I think, I hadn't really thought of all the different steps that we've talked about, where I believe if you take the heavier ultrasound with you, you have to unplug it and plug it in, hard to move.
Oh,
And
they're very heavy. Like if it rolled over your foot, it would probably break your toe. Like it must be in the hundreds of pounds. It takes, I've timed it, it takes in the minutes to reboot once you've plugged it back in. Um, it's kind of akin to those old cathode ray TVs we used to buy, like the big square Sony massive things that great, when you once you got them in position and turned them on, boy, were you happy you bought that. But man, if you had to move that thing or do anything with it, you're just swearing and throwing stuff and so
I can't even imagine. I mean, I picture, first of all, pushing something that heavy. And I'm not sure if you mentioned, do you have to take these through the hospital? Like, what kind of distance are you traversing to get from with those big
yeah,
ones in the be?
it's a great question. I mean, most hospitals would have emerge very close to radiology and also very close to ICU because they interact so often. We're right next to emergency, but it's still I don't know, a 2 minute sort of walk, depending on how you move the cart to emerge. ICU for us is up a floor.
Hmm.
So it's down the hall, up a slow elevator, and then down the hall again and into ICU. So it's probably more like a 3 or 4 minute walk, even though it's relatively close. It's just above us in terms of the building layout. But you are walking with a heavy machine, and it tends to not drive very smoothly. And I also think it's just the ergonomics of the machines. It's easier to roll over your cables, and it's you almost don't want to do it because your de facto is to bring the patient to you, which is probably not the best for the hospital or the patients in many situations. They're best left in ICU where you have all the support of the ICU. There's no chance of getting their lines and tubes hooked, snagged, pulled out, kinked. Every time you move a patient like that, it's a huge deal, and it has some implications for them. So you don't want my selfishness of not wanting to move an ultrasound machine to get in the way of proper patient care, which is to do the right thing. So we would always lug it up if we had to, but it was just that extra barrier where you're like, oh, I just wish I had something a bit more portable.